There is a new statement by the FDA regarding the safety of breast implants that's very important for anybody who has breast implants or is considering breast implants to definitely know about. And this is a statement that just came out today, and I'm going to go over it with you on this video today, as well as my recommendations and what you need to know. I'm Dr. Anthony Youn, America's holistic plastic surgeon, and I help health-conscious women over 30 look and feel their best by teaching them a holistic approach to health and beauty. And today we're going to talk about breast implants because this is a huge and hot topic, the safety of breast implants. Now I'll tell you, breast augmentation is probably my #1 most popular cosmetic surgery today. I've performed thousands of them in my career, but there are safety concerns with breast implants that all women need to know about, and it's really good that the FDA went ahead and released this statement today. So what I'd like to do is let me go over what they're recommending with breast implants. The first thing that you need to know about is that they are recommending a boxed warning label to breast implants. And this is a boxed warning that's put on all of the breast implant boxes basically, and in order to inform patients of the potential risks of breast implants. This is a big deal because this shows that there are definitely some safety concerns that patients need to know about. It doesn't mean that it's not safe, it just means that patients need to be educated about these risks. And the important things that the FDA is highlighting is that breast implants are not lifetime devices. If you undergo breast augmentation with an implant, that implant will need to be switched out at some point. And the older the implant is, the higher the risk of complications, the greater the chance that that implant could break when it's inside of you. And these are things that your doctor needs to tell you about at the time of your consultation. Also, it is very important for all patients to realize that certain breast implants come with the risk of ALCL, anaplastic large cell lymphoma. Now, as of this recording, there are over 500 confirmed cases of breast implant-associated ALCL in the United States. And there have been a handful of people who've actually died from it. So this is a very serious thing. But what we know about today is that there has not been a single confirmed case of breast implant-associated ALCL in women who have smooth implants. They have all had at least some history of a textured breast implant. Let me grab the smooth and textured ones here for you, and I can show you that this is a textured breast implant. It's also known traditionally as the gummy bear type of implant, where it has a sandpaper textured type shell. This is a smooth implant, and this is a very smooth shell, and there once again have been no confirmed cases of patients who've developed this from smooth implants. Because of that, I only use smooth implants in my practice, and I've only used them for the last several years once we figured this out. So it's also important to realize, and this is also the FDA is recommending this be put on all of the boxed warnings, is that breast implants may cause symptoms such as fatigue and joint pain. This is huge because all of those thousands of women who have symptoms of breast implant illness, hair loss, rashes, muscle aches, joint aches, fatigue, brain fog, all of these symptoms, for years, for decades, doctors have told them that it's in your head, that it's not due to your breast implants, that there's no chance your breast implants can be causing this. And this is the FDA saying that that BII, breast implant illness, is definitely possible. And I'll tell you, I believe breast implant illness is real. I don't think that it happens to the majority of women. I think it happens, from what I can see, to a fairly small percentage of women, but it's real. And for us to take the steps as plastic surgeons to acknowledge this is super important. So that's what the FDA is recommending in this box warning label, that breast implants are not lifetime devices, that the chance of complications increases the longer it's in the body, risk of ALCL and BII. And they are recommending that the companies put together a decision checklist for patients so that when they are considering breast augmentation, they are being educated about these risks. Now the FDA is also, now this is another huge thing, the FDA is recommending that implant manufacturers include product ingredient labels that are easy to understand, including what heavy metals and chemicals are in breast implants. So what does this mean? Well, there are a lot of women who believe that the chemicals and the heavy metals that are in the breast implants themselves, in the shells, in the silicone that's inside of them, that can cause people to get sick. I know of absolutely no studies that have confirmed this. I'm definitely interested, if anybody's watching this, if you've got that study, that information, I would love to see it because I'm real interested in that. But at this point, we just don't know. But I do think it's important for patients to know that your breast implant may not just be 100% silicone, but there may be other parts, other things, chemicals in your implants for you to know about as well. And this is important for future studies. Also, another big change with the FDA, they are recommending that silicone breast implant patients undergo new screening, either an ultrasound or an MRI 5 to 6 years after surgery and every other year thereafter. And this is because they're seeing that the risk of rupture of the implants breaking starts to increase at around 5 to 6 years after surgery. And so to monitor that, using ultrasound or MRI is definitely helpful. Now, this is very different than their last recommendation, which was to get an MRI 3 years after surgery and then every other year. The problem with MRIs, they are super expensive, and most patients aren't going to pay the money, which could be thousands of dollars for that MRI. The fact that they're adding ultrasound into this is a big deal because ultrasounds are not that expensive, and they can now be utilized, or they're recommending them be utilized 5 to 6 years after surgery and every other year thereafter. So this is a huge deal. The FDA has released this statement. You're probably going to see news about it in magazines and on the internet and in the news shows. But I wanted to give you a few of my thoughts about this as a board-certified holistic plastic surgeon. First thing I want to say is I do think that this is a welcome move by the FDA. Safety should always be our #1 priority. And what happens in the field of plastic surgery is that there's so many doctors who put commerce, they put money ahead of patient safety. There's so many doctors out there who are performing breast augmentation where their consultation is not, let's talk about whether this surgery may be beneficial for you, including the potential risks of this operation. But their complication is, let me sell this operation to you so you can sign up with me so I can make the money off of you. Okay, now here you are, you're watching this. You either have breast implants or you're maybe thinking about it or you know somebody who's thinking about it. You are a person who wants what's best for you. You're not a consumer like you're buying a car or a new stereo. You're a patient who's got one body and one chance in life to do the right thing for your body, really. And for a doctor to put his or her finances ahead of your safety and ahead of your health is absolutely ridiculous. And that is happening. You know, I actually have gone undercover. Now, before I was well known, I went undercover and went to some bargain basement cosmetic surgery centers just to see how they would actually treat prospective patients. And what I experienced going to 2 of these places was this hard sell of buy, sign up, sign up, sign up. And I have patients tell me this all the time. So this is, I think, really important because the FDA is now mandating that patients get educated, like you get educated about the risks of this operation, and educated not just about some of the simple things that we've known about, but for other things like breast implant illness and ALCL that is so easy for maybe some doctors to try to push under the rug because they want you to sign up with them. So I think that's really important for the FDA to do this. I think it's also, this is further proof that we do really need to continue conducting those studies on breast implant illness that are definitely being done now, today. And I commend all of you women who have breast implants, who think you've gotten sick from it, for you not taking no as an answer from your doctors, for you congregating, for you spreading the word, because it is important for us as plastic surgeons, as physicians first, to always put that first. And because you have risen up and spoken, the societies are now pushing to get these studies done, which is so, so important. Okay, we are not, the doctors and the patients are not fighting, shouldn't be fighting each other with this. We should be working together for what is best for the patient. And I commend the societies for really taking that step. And the leaders of the societies, the American Society of Plastic Surgeons and the American Society for Aesthetic Plastic Surgery, for taking that step and educating patients. I would implore also that the FDA take the next step and only allow true board-certified plastic surgeons to perform breast augmentation. Okay, right now it is completely legal if you're thinking about having a breast augmentation for any doctor to try to convince you to let them do it. Okay, I could be an emergency room doctor with absolutely no formal surgery training, and if I can convince you that I'm a breast implant specialist and I've got an OR in the back room of my office, I give you a good price, and I can convince you to do that surgery, then it's completely legal for me to perform breast augmentation on you. And this is happening all throughout the country. Women just like you and your relatives and your friends are being duped by phony plastic surgeons to undergo this operation. And do you think that those doctors have been educated about BII and ALCL and all these potential complications so that they can educate you? No, they haven't, because where are they going to get it? They're not part of these plastic surgery societies. They get their information from a weekend course where they follow a doctor around for a few days and then they start doing this operation. So breast implant surgery is one of the most common operations out there in the wild west of plastic surgery. So definitely do your homework and know that there is a better way, that you deserve better than that. I need to say as well that once again, as I said at the beginning of this broadcast, at this video, I've done thousands of breast augmentation surgeries. It is one of the most common operations that I do, and I still perform them today. I do them all the time, but I educate my patients about these risks, and as time goes on, we're learning more and more about them. And so if you're considering breast augmentation, this video is not to tell you don't do it. This video is to encourage you to do your homework, to demand that your doctor truly educate you about these implants. And if your doctor doesn't, then go and find a better one. There is a better way than the cut-first plastic surgery of yesterday. Going holistic with your plastic surgery is the way to go, improving your health, using surgery as the absolute last resort. I'm Dr. Anthony Youn, America's Holistic Plastic Surgeon. More good information on breast implants in these next videos right here.